All right. Assalamu alaikum wa rahmatullahi wa barakatuhu. Ahlan wa sahlan. Welcome everybody to our Enriching Talks. Now this is episode number 8. All right. Um we have, as might be new for a few of you, I do these enriching talks with different speakers. I've been doing it over the last few months. We try to have a new speaker every month. And this one is a very special one because I'll introduce my speaker in a bit. Okay. So starting with the introduction, that who am I for all of the new people that have joined. My name is Hafsa Qureshi. I am based in Kuwait, originally from Pakistan, educating moms and doing these sessions and teaching online classes and workshops and everything online. I'm a certified childbirth educator, a doula, certified from Lamaze and Amani, and a lactation professional certified from WHO, UNICEF, and Birth Kuwait. My specialization is in VBAC, which is vaginal birth after a C-section. And I'm also the executive assistant of Amani Birth and on the executive board of Birth Kuwait. So I like to do these free sessions because, of course, all the other services are paid, but these monthly free sessions just helps me to connect with all of you and give you a special topic or a special place of discussion on something related to pregnancy, birth, postpartum, motherhood, babies, breastfeeding, newborn care, all of that related stuff. So, just want to reshare the mission and vision behind these talks. Why did I start doing them? So this is not your usual talk show. This is for a purpose. It's here to address a certain community of ladies and women from all around the world. So I see some of the names that are popping in, and mashallah, I can see people that are obviously in Kuwait, outside Kuwait, all over the world, literally. All right. And I see some from the Far East, from Pakistan, from the UK, from Australia. I see lots and lots of names. So the mission is to bring all of these beautiful women who need support in pregnancy, birth, postpartum, and everything, where and when, right? Depending on what topic we are talking about. So we've had, if you can go to my YouTube channel, which I'll share in the WhatsApp group where you joined, I have all the previous recordings of the previous episodes. We've done with a speaker who had, mashallah, 20 kids. I've done one on infant loss. I've done a home birth story, which was in my language. I have done, what have else I done? I've done a woman who's, mashallah, managing her toddler and her business. I've done one on Ramadan and pregnancy. I did one on general postpartum. And today is extremely very special. Why? Because April is the C-section Awareness Month, right? April talks about the general statement worldwide is that we want to spread awareness and give the women support who have given birth through a C-section. Because I'm a birth worker, as a childbirth educator, and a doula, I just want to take this moment to acknowledge that regardless of how you give birth, you're still an amazing mother, right? And a C-section is a major surgery. And if you've been through it, you need even more support. It is not the easy way out, right? So this is why, to honor this month, if you go into my Instagram, I've shared an amazing, empowering C-section story of one of my moms who took the classes with me and empowered herself with education and made informed decisions. And then to do this session with Anna, I'm going to introduce her in a bit, to help moms who, okay, you've experienced that C-section. Now what? What's next, right? How to get the recovery support? What are the things to take care of? We often are focused during pregnancy on a lot of things, and we forget many a times that after birth, the postpartum period, the recovery period is even more important. All right. So, I was lucky that I got to manage to get Anna on board. So who's Anna? First, let me introduce how I know her. So when I was after my third baby, who was my second VBAC, so I've had a C-section. Yeah, by the way, I want to say that I relate with every C-section mama who's here right now. All right. I have had one C-section 16 years ago, which was extremely traumatic. And that's where and how I dwelled into this journey. And alhamdulillah, I had my first VBAC 12 years ago, and then my second VBAC almost 7.5 years ago. Alhamdulillah. And in the last 13 years, I've helped over 1,000 moms with natural birth, VBAC after 2, 3, 4 C-sections, empowering C-sections, all sorts of birth, postpartum breastfeeding, all of those journeys. So I relate when it comes to C-section recovery. I relate with mamas who've been there. So because I'm one of you, all right? So after my third baby, I realized the importance of taking care of yourself, and seeing a physical therapist is crucial in the postpartum recovery phase, because your body has gone through a big change and it's resettling in. And if things are not done right, it can really mess up things. And it did it for me. It messed up my back. I had bad diastasis, all of that. And I was blessed to find Anna through lots of recommendations, and lots of friends know her as well. So she was amazing. I have to say, she has to be one of the best women health physical therapists specializing in pelvic floor health in Kuwait. So I'm going to just read a brief intro, and then I will be letting Anna start speaking as well. So she is an international pelvic health physiotherapist, a mom of two, mashallah, who's experienced both. So both of us here have a common thing. We both are C-section mamas as well. She's gone through a vaginal birth and a C-section birth, right? And she has been working in this field for the past 13 years. That's another common thing. And specializing in prenatal and postnatal care, especially pelvic floor dysfunctions. And we don't realize that. We don't realize after birth, even if it was a C-section or a natural birth, our pelvic floor takes a toll. So this is where she comes in, right? Which can impact your sexual health. It can impact your subsequent pregnancies. So many factors affect this. She's worked globally. So that's another, mashallah, specialty about her. I met her while she's in Kuwait. Right now, she's joining us all the way from Spain. And she's also equally passionate. She gives from her heart and soul, literally, and tries to help as many women out there. You can see her 2 Instagram accounts on the screen. Please make sure to follow her as well, so that you get the tips. She's always sharing lots of tips and things that you guys can benefit from as well. And she believed that each woman is unique and deserves a good pelvic health, which starts with understanding what is happening in your body at each stage. Until we understand that, we cannot help. So Anna, welcome, a very warm welcome. Ahlan wa sahlan. Welcome to my talk, and it's such a privilege to have you on board today.
Hello, Hafsa. Thank you so much for your words. Actually, I feel like so happy to be here today and to create this safe space to talk and to raise awareness that I think is so needed, and support women through this life stage that we have is postpartum, right? After a C-section, which is another story. It's different than a vaginal birth. Having this experience also gave me like new concepts, new experiences, and new tools and tips that I can share today also. All right. So thank you so much for the invitation. Yep, and let's start.
Yes, so let's just start. So Anna and I, we came up with a list of things that we want to talk about. And in the end of the last 5-10 minutes, we will take some of your questions as well. So Anna, what are the most important things to focus on in the first few days post C-section to support healing? What do you think?
So I will start with the first one, which I think is the major one, that is resting. Okay, the beginning, we need to rest a bit. We need to let our body to go through all these post-operation, right? And we need the first days at the hospital also, take it easy, rest. We need to push ourselves a bit, of course, because movement is important. And usually nurses, they are there to help you a little bit in the beginning, right? But we need to listen our body in the beginning, which is like, I would say, like we rest and breathing exercises to start having some connection with our breathing, with our pelvic floor, with our abdomen, all right, with the diaphragm that we will talk, and we will go deep on that later. Gentle movements, like if you can just, like do it without help, that movement. So why not, right? Or, like start like sitting a bit as early as possible, or standing. That will also help for the recovery. And the pillars, which are very important ones, which is like sleep, nutrition, right? Hydration, and the stress also, the emotional. How are we dealing with this C-section, right? It's not the same a planned C-section than an emergency C-section. Also, I think emotionally, how
Yes,
we take this, right?
of course.
So, and to have the support around us, which is important, like to have everyone helping with the baby, because actually it's not just you had an abdominal surgery, that you have an abdominal surgery and a baby also, right? That you need to take care of, that you need to start with the breastfeeding, which is already a lot of physical demand. So it's a lot of adjustments the first days and the first weeks, actually. Um, so, yep, the emotional part, I think it's very important. Depends on how we enter this C-section, how we just land on this C-section, right? What happened before that? I think that's also an important part of it.
Very true. Very true. And it's very vivid as well. You don't forget your birth experiences, right? So even if it's been 16 years for me, I think that one of the most important things I remember after a C-section, and mine was an emergency one. So I was not
Okay.
prepared for it, right? And yours was more planned. So in my
Yes.
case, I remember just, it was like a truck hit me literally, and a lot of support was needed, like even simple things like going to the bathroom and just picking up your
Yeah.
baby. Small things needed help. So my tip here, additional to amazing, I mean, Anna explained it better. My tip here is try and uh, walk and don't refuse your painkillers. Most of the painkillers are
Yep.
breastfeeding safe. So take those
Yes.
painkillers. Don't torture yourself, right? And walking, like she said, start with breathing, focusing on that. And then the sooner you walk, of course, with help, the better it's going to be for you.
Yes, that's true. We need to move. Yes, exactly.
Okay, so which comes to my next question. So, how soon is it safe to start the gentle movements and walking? And what would it feel like? Because you had yours more recent. So, what does it look like in the early days?
The thing is, my case, I always say like it's unique, right?
Of
So
course.
each woman will have a different C-section recovery and experience at the end, right? So in my case, it was a really tough one, C-section, in terms of complications during the C-section, which needed like to reopen, to have like extra, like to have
Yeah.
blood transfusions, and to have, because I literally had a big hemorrhage. So it's not like the kind of what people usually common, right? About the C-section recovery. So that's why always I say like depends, right? For me, I stay long time in the hospital just recovering from all this because of, like anemias and all this. So but from other people and other experiences from other mamas and clients that I've seen like for all these years, that usually you can start doing this like 1 week after or a few days after, when you start like walking, when you start going to the bathroom alone, when you start like taking a shower, that you are able to move a little bit more around, to do few steps and to be like in your room and then go out, right? So when you start like from the small to the big, right? um then you are able, of course, we are breathing all day, right? So we should be able to connect from the beginning, to breathe out and go inside with the belly, to feel like the connection with this area, pelvic floor, to feel like, oh, am I having incontinence? Am I having some problems on the bladder? How is constipation? Also, what is it happening with my digestive system, right? So all this screening of the bladder, the digestive system, what is it happening there also. So all this can help to just start with the exercises, to say as sooner as you feel you can move a bit, so go ahead and start breathing right properly, and abdominal and this kind of breathing and gentle exercises.
Think exactly. I think just like in labor, so in the contractions, what I teach the mamas is the deep breathing. So now, okay, you are postpartum now, the baby's here, but because of the recovery you're facing and the pain and your body just went through a major surgery, it's like 7 layers have been cut. The same breathing techniques would help. That's what I just want to say, that, just focusing on your breathing is going to help a lot. All right. What about taking care of the scar? So
So the scar,
yeah, short and long
yes.
and both.
So the scar, I experienced, like, because I've seen in Kuwait many clients with a woman with C-section scars, and I always ask, right, how is the care like in Kuwait? What are techniques they are giving you there, right? And then I compare it to Spain this time also to see, like, is there a difference or not, right? And yeah, there is a difference in terms of here in Spain. I mean, you have it covered for some days, right, until they remove this compressive one, and then it just, you dry it out. This is like the recommendation.
All right.
Just dry it out. That's it. Don't do anything, like just dry it out until usually you see your midwife around 2 weeks, 3 weeks postpartum, right? So then they check the scar. If it's a scar, it's closed and there is no infection, everything is fine, right? You can start touching it, right? But usually it's not like you don't wait 6 weeks until you start touching the scar. This is number one thing. You start a little bit earlier with this if everything is fine and it's getting smooth recovery on the scar. And number two is dry it out as much as you can. No, right? So to just don't put any, because I was asking, I mean, this is stickers, right, that we apply
Yes.
on it and all this,
Absolutely.
right? And it's like, well, here midwives, they say there is not a lot of evidence about it, so just try it out. This is the important. And of course, like the underwear, the cotton, that this is important, that it's not, that it should be a little bit loose, right? Underwear on the pants, that nothing is pressing on it, right? That you don't feel like uncomfortable with the scar when you put like your underwear. This is important. And cotton, please, exactly, to have this kind of underwears, right? I think, yes, that was, and actually breathing exercises, I'm going again with the breathing exercises already is a massage on the scar. You already are moving, the tissue on the scar. So just breathing, like, and having a 360 breathing, it's actually it's moving the scar when you do it. So actually it's already the first movement that we should be doing for the scar, right?
Right, of course. And now that you think, I mean, I used to think that, that actually you need to do something, and I'll talk about the scar massage in a bit. But the very important point that you just mentioned is that breathing itself is actually moving the tissue, which even shows even more the importance of breathing. So it's benefiting you in two ways, subhanAllah. Thank you for sharing
Yes.
that. So now the next one, which I was just mentioned, the scar tissue massage. As a physical therapist,
Yes.
what's your recommendations on it?
So the first thing is about the scar. First is like, can we touch it? I mean, sometimes a scar, a more C-section, that I think there is a lot of emotion there, right? Because sometimes you are prepared for something else, or right, and then circumstances happen and you cannot control some things during birth, and there is an emergency, right? So this actually is a trauma, right? That gets like stuck there, a lot of emotion. So first is like, can we touch it? What happened if we touch it? Just a gentle pressure, right? Is it okay with it? Or I see a lot of clients, of women, that actually it's like, don't touch it. And it's like, why? Right? Why I cannot touch? I mean, it should be integrated in our skin, in our body, this area, right? So as soon, if you want to touch it, go ahead and start touching your scar. It's okay if it's closed, there is no infection, right? So you start like touching and feeling and connecting again with this area, because it was like fat and blocked, right? So we need everything to go like flow, the area, circulation, and emotions. This is the other thing. So first we start touching, gentle pressure. There are a few movements that we can start doing, which are like, for example, circles, or for example, vertical movements, zigzags, or also I say like pulling a bit up. That could also be an option while we are breathing. Or for example, like a pimple, right? That it's like pulling it out a bit.
Wow.
Before that, I mean, these are the movements that we can do with the massage. Massage, you can do it without anything. If you want, without oil, right? To just feel the area and be able that it's not like sleeping, right? Your hands while you do it, and you actually work the tissue. But if it's very sensitive scar, that it's very recent scar that you cannot touch, that you can I mean, that you feel very sensitive the area, we can start the desensibility techniques, which are, for example, you apply brushes. You
Yes.
can just have like brushes and apply some brushes, some pressure to just have this area in a different way, different inputs, that this will release also some blockage on the area. Brushes, or for example, temperature, like cold compresses, warm compresses, to have this changing, alternating one and the other. And so it's another input that you can put on the scar if it's a scar very sensitive, or right. And sometimes also it's numb. And this is a question that we always that I get asked: how long will it take until I feel the area again, right? So this can be up to 6 months, right? That until we can have, but doesn't mean you cannot do some manual release, because the manual release and working on the scar, that will help for the numbness also. So it's very interesting to work on the scar, and there are like so many benefits on it that it will help you. And we need to start like slowly, and always better if you have some guidance for the scar.
Mm-hmm. All right. So,
right? Yes.
So when should, so this is what one of the ladies is asking as well.
Yes, yes, exactly. That's why I stopped, because I saw like there is a question, right? Yes. Let me just, which month should I start? All right. No, you should start. Feels like style is stuck towards the inside. Okay, we will talk about adhesions now. What is an adhesion? So I would start like these scars, like as soon as now, actually 4 months, like before that. Should be done at 6 weeks or 3 weeks, something like that. Then we can start like touching little by little. Okay, so 4 months, go ahead and apply pressure. No problem. Go ahead. So if we feel like it's a little bit stuck inside, right? Like the scar, it's like stuck in. This is usually an adhesion. What is an adhesion? An adhesion, this happens with any scar, okay? You can have like a knee scar and have an adhesion there. Or you can have a scar on your elbow and have an adhesion there, right? It always depends also how is your healing with scars. This is another genetic factor. But it's important, like if we move this scar, then usually we get less adhesions. So an adhesion is that, imagine like the layers, right? That Hafsa, she was saying like 7 layers that they cut, right? When they stitch it back, they don't stitch 7 layers. They usually stitch 3 layers. That's it, right? So at the end, the mobility, it's not the same. There are the fascia and the muscle, it's not sliding the same as before, right? So to not get stuck here, we need like to have mobility and flexibility on the scar. So a good scar is that I pull here. Imagine I have a scar here. I pull the scar and it's going out with my skin. That's a good scar. If the scar if I do this and it's inside, then there is an adhesion on the scar that needs to be treated. Wow. Yes, is that clear?
Very clear.
Okay, good.
Yeah, I'm surprised now. I'm going to go and check my scar. Is it pulling out 16 years later, or is it going?
So
adhesions can be released like through massage.
So the adhesions, to understand a little bit how this works, adhesions can be, so if it's a fresh scar, like 4 months, for example, a 4 months scar, this, let's go and move it, please. Okay, now it's the time to do it. For example, I had scar from other surgeries, and it was like stuck inside for 20 years because I was like a child when I was with surgery. So I work on the scar after 20 years and I got better, but not 100% because it was 20 years of scar adhesion, right? So if we do it now, first thing that I start doing with my scar, my recent scar, right, was like, please, I don't want adhesions this time. So I'm doing all this, right? And it's a big difference, of course, right? Regarding like the other surgery that I had. Also capping, it's another option. So we want to pull it out. I say like the pimple thing, right? Like you are releasing up, right? So the same way. So imagine like a cup. I put a cup here and I do suctions, right? So that will also release. I'm doing everyday cupping in my scar. And actually, I'm a very busy mom, right? That I don't have time at all in my life. So I massage my scar. How often should I massage? How, right? This is like, I think, like the other question. So, my case, I'm doing, for example, 1 minute per day because I don't have more time and I have a toddler there jumping into the bathroom at the same time right? So, and a baby crying at the same time. So, I'm doing 1 minute, a little bit of massage, then 1 minute, the cups, all right? And it feels a different, but I'm doing it every day. So, you can also do it different way. You can do 5 minutes, right? And do it 3, 4 times per week. You can do 15 minutes. So the idea, the goal would be, all right, to have like a 15 minutes work, or 5, 10, 15 max, okay? To have a work on the scar, and at least to do it twice, 3 times per week. All right, that will be amazing. Until you feel, oh, now there is like no adhesions, right?
Yes, you can lift your scar, like Anna said. That's one good tip I think I walked away with, and that's what I'm going to be practicing next. Amazing. Yes, I think the adhesions make a big difference because, like I said, I work with VBAC moms as well. So moms who've had previous C-section or more than one. And I feel that adhesions play a big role on how labor goes, how things
Yep.
progress, how
Yep.
successful she would be with her VBAC as well. So addressing
Exactly.
adhesions now is very, very important because what adhesions can do actually, because it's like scar tissue, right? It can, like Anna's explained, the mobility part, it can hold back. It can make labor longer. It can make labor harder. It can do so much that we can't see visually. So yes, this is why the importance of scar massage. Um, which reminds me, so this needs to be done postpartum. What if someone is expecting now and they didn't do scar massage? Would you do it or would you recommend it during pregnancy or no?
You mean a VBAC that already has a scar
Yes.
massage, right?
Yes.
Depends on the scar always, right? Depends on the scar. And already with pregnancy, the scar will already stretch,
Right.
and some adhesions will already disappear. And sometimes I always ask with the pregnant mamas that they had a C-section, is it painful, the scar, during pregnancy or not? Do you feel it or not? Because sometimes it's okay, there is no adhesions, right? And just it stretches, and that actually is already a good exercise for the scar,
Of course.
right? So already will stretch, which will make things easier for later on,
Right.
right? So already sometimes that's the best exercise to do, right? That it stretches. But that's why always they say, like, wait at least 1 year and a half. In Spain, they say that. I know in Kuwait is less, but at least 1 year and a half or 2 years until you get pregnant again after a C-section, because of the scar. That the scar, to be flexible and to not have any major risk, right?
Yes, and I agree with the same because now the recommendation is not between births, you want at least 18 months, right? So
Yeah, yeah, yeah.
it is the thing. We are getting some questions, so I think I'll keep all the questions
Okay.
at the end. So we'll answer all the questions, and
Okay.
I want to jump to your specialty, which is where I think many women are lacking, and I really want to spread awareness about this, pelvic floor health.
Yes.
After a C-section, is pelvic floor health also impacted?
Yes, because we were pregnant.
Thank you.
So we were
Many
pregnant
think
for 9
otherwise.
months.
So can you shed some light on it and how is it impacted and what should they be doing?
So the thing is, because of that, I have it every day in consultation, right? Like, I had a C-section, I don't need to check my pelvic floor. And that's very wrong thing, right? You were pregnant, this is number one. And you use your pelvic floor, usually. Number two, pelvic floor. What is pelvic floor? Pelvic floor is the area, the muscles, let's say, right, that they are supporting bladder, uterus, and rectum, right? So the organs, and has a function of sexual also function, right? And we have the incontinence or constipations, diarrheas, everything like there that is happening, childbirth, of course, right? Pregnancy. So it's there. It's all like on the core system. It's the base of it. So during pregnancy, there is more weight on it, right? And it shifts from the position also, the pelvic floor, and hormones also happening, which everything is more relaxed usually. And after a C-section, what happens? So usually this gets also kind of trauma in terms of physical talking, that it can make like a little bit more tight after a C-section. So common things that I see on pelvic floor after C-section could be, we need to check always and see, because everyone is unique, right? And we need to know what happened before getting pregnant also on this pelvic floor. How was this pelvic floor before getting pregnant, right? But pelvic floor, we can have different scenarios. We can have a pelvic floor that is weak. So we can have maybe a leakage after having a C-section and pee myself. Why, right? What is happening there? I can have, maybe it's not about weakness and I have a tight muscles. I have tight muscles, and before, now during intercourse, I have pain. It's like, how do I have pain now after a C-section if I didn't have a vaginal birth, right? And the pain usually it's more like on the lower abdominal, on the scar area. Could be painful also during intercourse. So these are like the different scenarios that we can have, right? Or everything is fine. I also see after a C-section that I check and I say, perfect, everything is fine. We have good strength and it's a healthy pelvic floor. So just let's focus on other things, right? And just integrate it. And we start with connection exercise and rehab program to just integrate the pelvic floor in a healthy way. That's it, right? Depends on the person, but there are many scenarios, and pelvic floor has a big role also during pregnancy, postpartum, either vaginal, of course, we understand that point, but also C-section.
Very good. Thank you for saying so, because many think otherwise. So ladies, even if you've had a C-section, your pelvic floor does take a toll. And this is why the pelvic floor exercises and toning it and having a healthy pelvic floor is important. What are the pelvic floor exercises you would recommend during pregnancy and postpartum?
I always say depends on the pelvic floor that we have. I mean, if we have a tight pelvic floor, then I would not recommend to do any kind of Kegels, let's say, right? Always we need to get checked before we start any exercises on the pelvic floor area. That's my recommendation, because we don't know. And I've seen like so many tight pelvic floors in my life, let's say, right? Unfortunately, that we have a lot of tight pelvic floor muscles from stress that we clench, that we squeeze, and or experiences also, and right. So always we need to check if we are having a tight pelvic floor, or everything is fine, or we have more like kind of weakness, right? And that we feel like a little bit more loose the area.
Yeah. I remember getting it checked with you, and it was enlightening experience. I didn't realize how much connection there was. And honestly, you will thank Anna in your old age, or even now, like when it's like she said, it's connected with your. I have a pelvis here. So this is the pelvis, and the baby's coming here. So it's not. It's like the baby going through, and it's all the other muscles here, right? Which are supporting your bladder, your anus, everything.
Yes.
So, urine inconsistency, just coughing and urine pee, like you leak yourself, or just sneezing or laughing, all of that starts getting more common, regardless of the kind of birth you've had. So,
Exactly.
it's important for all to, like I say, we all think that after birth we should see our doctor. Yes, definitely do that. I'm not saying don't do that. But even more important is find a women health physical therapist. In Kuwait, we're blessed to have Anna, and get yourself checked. It's even more important than seeing a doctor, in my opinion. And it's not just the pelvic floor. I'm coming to our next topic, which is the abdominal muscles, the diastasis.
Yes, exactly. Now I was going to talk about yes, it was perfect. So abdominal pressure, this is another thing, okay? Another concept that we need to understand in life, not just for a diastasis recti, it's also if we have a prolapse, if we have a constipation, if we have any other pelvic floor dysfunctions, and we need to understand how our system, our pelvic area is working. First of all, we have 3 diaphragms that I also wanted to mention, right? What is the relation with the breathing and, for example, pelvic floor dysfunctions? Why is this so important? Why we are talking about breathing all the time, right? So we have, and this is also something that I'm sure you are using, Hafsa, we have 3 diaphragms. We have like this area, we have a diaphragm here. So open mouth, right? Or closed mouth. This is important. And we have the diaphragm on the rib cage, right? This area. And we have, this is the one from breathing that we all know from Pilates, maybe from, going to the gym, or maybe from yoga, right? And then we have the pelvic floor diaphragm, which is like down the area that you were pointing. So all this area, it's the pelvic diaphragm also. So these 3, they are all connected. Okay, when I'm open my mouth, it relaxes the pelvic floor also. So during childbirth, with the pushings, with all this that Hafsa, she's amazing, right? So usually you open your mouth to relax and to be able to dilate, right? So imagine how is the connection that already we are using it for many things in our life. This is number 1 thing. Then abdominal pressure. What is abdominal pressure? We live with pressure. We have air inside our cavity, right? We have the abdominal cavity, thoracic cavity. Okay, so we have air inside our lungs for sure. And then we have also abdominal, the cavity. Also, we have some pressures. Okay, this is physics, I know. Okay, it's very into detail, but we need to understand how this works. We can have the core area, which is like all this area, right? This is the core. And when we say like, activate your core, or, like, let's do core exercises. All right, are you feeling the core? Are you feeling the core exercises that we are saying? So the important is to understand we can have this area as a metal can, for example, like a Pepsi Cola metal can, right? That if you apply pressure, it's difficult to deform. So this area is very difficult to deform. But if we have like a balloon and you apply pressure on the balloon, it's easier that the air goes out, right? So imagine that we have our abdominal wall, the muscles, the rectus abdominis and all these muscles. There is separation that is called a diastasis recti after giving birth. And then we are applying pressure. So if it's a balloon that usually very weak the area, it can deform. And hernia, it can go into a prolapse, it can go different ways. So it's important always to work the core, understanding this abdominal pressure. Okay, to not start doing things that is causing hernias, or it's causing more diastasis recti, or it's causing a prolapse that was not there before. So important in postpartum, first to understand how to manage this pressure. Then usually we talk about doming, right? When I do a crunch, is it pushing out the doming? This is the pressure going out, right? So this is not good. But can you reduce it with some techniques, some cues that I can give you? Can you reduce it with pelvic floor, for example, exercise? Then it goes inside, fantastic. Then it's a safe exercise. Because usually it's like, everyone says like, what is the list of do's and don'ts that I can do with a C-section or vaginal birth, or right, during postpartum period? So there is no list on do's and don'ts. Before we had it, but now it changed, like with the new evidence also. It's important, it's how you manage your abdominal pressure. Are you able to do like a metal can that you apply pressure and nothing is coming out? Or actually it's more like a balloon that when I cough, I'm pushing out. I'm having a doming, right? Am I having a doming? Like I hope everyone is understanding this, because it's crucial. It's very important. It's the key of any exercise. Let's say I'm going to do a dead bug, right? With the arms and the legs, both legs up. Is it pushing out my belly? Then it's too much. Then we should not be doing that. But can you reduce it with some pelvic floor activation, with some deep abdominal connection? Are you able to just reduce and then you are not pushing? Then maybe it's a safe exercise. If not, we need to make it easier in our body, right? So there is no program that is unique. the best for everyone. There is no magic exercise. It always depends on how you manage the pressure.
SubhanAllah. Excellent. And again, I think this is what I learned from my mistakes, honestly. This is why I keep telling the mamas, please don't neglect this part. I didn't realize that there was even something I need to worry about when it came to the diastasis. And then when I went and saw Anna, my diastasis was so bad after 3 kids. It was more than 4 centimeter separation. I'm still working on it. So please, ladies, don't ignore it. Postpartum, physical therapist workup is crucially important. Now, this diastasis is pregnancy, right? It's not related to the kind of birth.
Yeah. This diastasis actually usually with C-section could be even worse usually than vaginal birth. So, but because we have a scar there, which is not allowing, the recovery, the natural physiologic recovery that we have, right? Yep. Week 34 pregnancy, usually everyone, 100% of women, they should have a diastasis recti.
Okay.
So we should be having a diastasis recti, and so the baby can grow and it's healthy and it's physiologic, it's good. Okay, we should be having a diastasis recti at that point. So usually it opens up on the above the navel, right, the belly button. So it opens first there, and at the end it opens more down because the baby is more down, right? And it's normal. I mean, physiologic. It's something that should be happening. In postpartum, usually it heals first down and then little by little up, but can be the centimeters. We're talking about if we talk about centimeters, because they change a bit the approach on the diastasis recti the last, I would say, year actually. The separation, it's the centimeters. It's something that we check, but we don't rely on it too much. It's important. It's the function, how strong you are, and how is your core area, right? Is more metal can or a balloon, right? So this is like the important to have strong muscles that will help for your diastasis recti, even if it's a 4 or it's a 2 centimeters. The important is how you are managing the pressure again, sorry. But yes, this is like the concept, very important concept to deal with it and to manage. Okay, so diastasis recti, it can be open, let's say, right? This is the concept because it's easier to understand when it's open and when it's closed. This is easy for everyone, right? A door that opens, a door that closes, right? So this door can be closed. We want this, right? To not be open door, but can be an open door here or an open door that way that is pushing out. Mm-hmm. So we want like a closed door, better if it's here for sure. But if it's a little bit open, all right, 2 centimeters or 3 centimeters, let's say, but we have good muscles that is not pushing out, then it's okay. We want this. This is the goal, to get like a good function on the abdominal wall, okay? To get a good function, because at the end we are doing crunches all day. We have a baby, we need to crunch, and you are doing all the day, you are doing exercises that is putting pressure. When you cough, when you sneeze, when you carry the baby at the end, this is like the thing that you do like many times during the day. So it's important to just understand this concept and start connecting with your abdomen, with your pelvic floor, to get this kind of movements, right?
Right, of course. So yeah, it is very important for us, and I think the breathing and core engaging exercises should continue throughout, whether it's pregnancy and postpartum as well, to help with this as well, alongside, because the toning part, like you said, how well the muscles are toned is so important. So what about the use of belts? What I know, and you can correct.
Yes.
They like as soon as the baby's out, they think the belt is just gonna put the stomach back inside and the corsets and all of that. I don't agree with it. I feel it actually mess up things. So and I tell them, I'm not someone who can tell you this. You need to see a physical therapist. So now we have you to tell them what to do.
So let's say now I think we have already the explanation of it. So you imagine the balloon that I was talking about. So this balloon, if you squeeze it with a belt, it goes down the pressure, right? So the air, it will go down. So we are applying pressure. If we are put a belt on our stomach, it will apply the pressure to your pelvic floor. So no need. If always depends, of course, right? Always depends. But if we are having a diastasis recti that is like no control on it, right? That every time just turning in bed, it's pushing out. I've seen these cases, right? That they can just a little movement, raising one leg in bed, it's pushing out. That actually when they walk, it's pushing out. That they have so many distension and so many loose skin. We're talking about bellies that usually I'm talking about twins or triplets, or bellies that they were like very big ones, right? And all this abdominal wall is completely open, and there is no control at all. Then maybe we need some support. There are these cases also that I say, yes, we need a support because muscles, they cannot work right now.
Right. But those would be rare. In general, no one should do it themselves.
No. Always it should be a specialist that is telling you what to do. Exactly, a physical therapist that will recommend you to put or not a belt, of course.
All right, and
but not these ones that I understand what you were saying. Not the Instagram, right? That they show like wrap yourself this way and every the stomach will go inside. We have the physiological. We know how to recover. Your body needs the time to just the uterus go back to normal, right? And to go little by little with the evolution, everything goes into place. But postpartum is at least 2 years.
There you go. Thank you.
It cannot, yes. It's not like something that is 6 weeks. It's impossible in 6 weeks to be fine, to be back to normal. We will never go back to what we were before. It's impossible. All right. So we need to, it's a new life stage. It's a new time in life, right? It's a new stage in like motherhood, right? And parenthood. And so we need to understand, we need to less a little bit our expectations and to just be more kind to ourselves, right? To our bodies. It's we cannot compare with social media. It's so bad, please. Okay, so no, don't look like these mamas that they had a C-section and then everything is in place at 6 weeks. This is not the common thing. This is not normal.
There you go. And this is a physical therapist who's been through it herself saying so. So what more do you need?
Yeah.
Yes. Be kind to yourself. And you are postpartum for all this time. It's never too late to start taking care of yourself. Especially as you plan your next baby, get yourself checked first. So just like we check, we check, oh, do we have deficiencies and stuff? I suggest a good workup with a physical therapist to make sure all is set is a good idea as well.
Exactly.
Yeah.
To be the optimal, best version of yourself, in the optimal place before getting pregnant. I did that for my second one. I got like very good shape before getting, and that's why I took like longer gap, like it's not like I went one after the other because I knew like this will be tough. I mean, I don't know how next pregnancy will be, right? So let's be prepared, I think, for any thing to be strong. And I feel the actually I needed to stop during pregnancy because I had like some medical complications. But even though now in postpartum I feel stronger than with the first one because I did all this work before getting pregnant.
There you go.
So this helped me now with the recovery. Imagine.
And despite the complications and stuff you face, and honestly,
of course, exactly.
Yeah. This is what I always say, that how you go into the pregnancy determines a lot about the outcomes and your recovery as well. And this is in terms of your physical fitness, your nutrition, your mental state, which the last thing
the pillars.
Yeah. The last thing I want to discuss before we go to the few questions is the emotional recovery.
Yeah.
After a C-section.
So, yeah. And I think this is like a big thing. Okay. I've seen like a lot of women suffering emotional talking, like in terms of feeling like their body, like guilt, or feeling like it was not enough, their body, right? That they feel this way. That's, no, you did everything that was in your hand, right? If you have the information that you had, I mean, always we need to get prepared, right? For, I think it's very important to get a preparation, the childbirth preparation, or a doula also, and to have someone helping you to have good um, decisions, right? If you take like the same as in your post, what you said about this birth story, the C-section birth story that I read. So it's this, right? Like you feel you did everything, and well, this was what it's meant to be at the end, a C-section. But you try everything before that. It's not like the choice that I choose, because it's harder, of course, everything in a C-section than a vaginal delivery.
I would say,
So at the end,
yeah,
no, go ahead. Yes.
yeah. So I was just saying that with the recovery part, even a C-section can be empowering with just like what Anna said,
That's it.
as long
Yes.
as if you've done everything in your power, you've made
Mm.
the informed decisions, you've educated yourself, and even then, if it ends up in a C-section, it's not a failure. You haven't
No,
failed.
that's it.
Don't let
That's
that
the
guilt get to you. All right. You are a tigress mama, regardless of how the birth outcomes are. And me, as a childbirth educator and doula and postpartum expert, I will support you regardless of how birth goes. Mamas need support, and we need to be kind to ourselves first.
Exactly. So positive, it can be, I had a positive C-section experience. I asked for it also. All right. I knew like my rights and all these things, right? So at the end, and I had very good support with midwife there here in Spain. And we discuss it, and we say like, should be also a plan. We should, when we have a planned C-section, because that's the way, right? My placenta was blocking, it was impossible. So we know it. So we should also plan the C-section, right? And I ask everyone, the anesthesiologist, the other, right? Like, hey, I want skin to skin. I want like to go with breastfeeding, because I know like we need to do it now, once they are still like stitching, I want my baby on my breast, right? So these kind of things that they need to support also a C-section, and to have a positive, I think like from my side, it was a very positive experience, because I could prepare also all this, right? Um, for myself, and emotional, I had a very good support also this time, a very good support with family, friends, right, helping around, which I think that we don't have hands for everything, right? So we need hands in postpartum. We need help. We need hands, and it's okay to ask help. It's fine. It's fine.
Yeah, I agree. And with regards to this is where, if you're taking my classes, you will get a part, like when you're writing your birth plan, one crucial, like it's a liability from my side, that you have a backup plan planned as well. So that, yeah,
Exactly.
all of you're planning for the birth we want, but should, la samhallah, things not go the way we want it, then a backup plan is a crucial part of the birth plan that I make sure every mom has, so that she's been part of the decision making, even if it is a C-section. So that
Exactly.
part, it helps us
We
mentally.
need to have mentally flexible a bit, to have flexibility for that day, because we never know.
Yeah, I agree. I agree, wallah. And it is very important that if you feel mentally not okay, if you feel still negative thoughts, and it's been more than 2 weeks since your birth, please, seeing a mental health therapist is not wrong. Just like you would see somebody for an illness, similarly, if you're not doing okay up there, you're not feeling okay, you're having depressive thoughts, or you just don't feel yourself, please seek therapy. Very, very important, because many women dismiss that and they're living with this trauma, and it will flavor your next birth, or it will flavor your child's upbringing as well. A baby needs a happy mama. So if you're not doing okay, please, please, please seek therapy. I'm not a mental health therapist. There's so many out there. I want you to connect with it. I will try to get one on in one of my talks as well. But yeah, it's very important that like our physical health, our mental health is okay as well. All right. Now we'll go to the questions let's go to anyone has any questions, you can type them in the chat so Anna can start answering them. So let me just go.
Okay.
I'll read out the question.
Good.
Right. So the first one you answered, that when should we start the scar massage? So soon. You can just repeat the answer.
Yes.
The timeline. How long should they wait until they start the scar massage?
No, as soon as possible. I mean, as soon as possible. I would wait until the scar is closed, that there is no there is no infection, and you can start like touching it, and it's not painful. Always will be a bit painful, right? But that it's bearable, right? That you can start moving and touching the scar. All right. So at least 3 weeks for sure that you don't do anything. And then slowly you see, and I would say like 6 weeks, you feel like I can go a little bit deeper. All right. Now 3 months, I was like, I apply a lot of pressure on it. Okay. But the first 3 months, so we go slowly, gentle progression.
Thank you. Should we wear a belt after the stitches are removed? So we talked about that. The only time I would recommend is just as you've had a surgery, just a gentle abdominal binder to help you move, but don't keep it on for too long. Just for the mobility part is something I would recommend.
One thing here, I see she has a little bit infection inside, Fatma. Yes, so this usually will take longer time, the healing. And then also the applying pressure and to feel like better, it will take longer time, the recovery. It's okay. Okay, everyone needs their own time.
Yes, thank you. And the infection part is what you mentioned is most important. Okay, I'm 1 year postpartum. It was my second C-section. Am I too late to work on the scar if I wish for a VBAC?
No, please go ahead. Never it's too late.
And how much, like, I'm not saying it hurts. Should it hurt?
Well, hurt. I mean, a bit, of course. We are talking about adhesion. So, of course, like when you apply, that you touch, you feel it, right? But it's not unbearable. It's something 0 to 10, all right? We at 10, you cannot touch it, right? So we are talking about, we are a 5, something like that in the middle of it. It's fine. We can touch it. If it's like 8, 9, 10, better, let's see what is going on with this scar, but better to see a specialist then to have a look on the scar.
Okay, so the belt question you answered, you did cupping and all with you at the clinic and everything was fine, but my first pregnancy, my stomach went back normally since it was normal delivery. Now 2 years postpartum, and I have a C-section shelf, the hanging belly, the mummy's.
Yeah, the pouch.
How to get rid of it?
Yes.
The pouch, yes, the pouch. How do we get rid of the pouch, Anna?
Well, exercise. We need to target good the TA and the abdominal, the core that we were saying, right? We need to have a metal can and to make sure that we are activating the properly muscles when we are doing the core exercises. So I started a new project that is called Physio Mama. And Physio Mama, it's online and it's through an application. I do customized programs for women to actually target this, right? So I focus a lot on core and to understand this concept and to work on exercises with progression to just get this connection properly done and to understand the core, how this works. And usually the mom pouch, right? It's about at the end, the lower abs. So we need to have a properly lower abs connection and activation to have it as strong as a lot of power there, right?
You see her Instagram. So the Physio Mama is on the screen. So
yes,
I will share it in the groups as well. I'll share the link of it so that you can check out her program.
Yes,
excellent, because I think that kind of guidance is what we need.
Exactly. To not do just workouts, right? To target the area that we need to improve.
Yes, thank you. All right, I'm 20 months postpartum. My scar is majorly on the right side. The area between my scar and belly button is completely numb. Feels very, very tight.
Needs to do massage and to do therapy there. Yes.
Needs
to work on the scar, release the scar. There are cuppings, there are needles also that we can apply. There are then machines, radio frequency, laser, shock waves also even, but with time, right? So there are many, many, many things that the physiotherapists can do.
Yeah. All right. And if you didn't find it, if you found a physiotherapist that didn't help you, then it's just keep shopping. Find another one, I think. Please, can you explain how to check our C-section scar for adhesions? So she said about lifting it, right? So you can just repeat that part.
Yes, so should be like the skin, right? That it's not like going inside, like you are pulling your skin out, right? This way. And it's not like staying inside. So just you pull the skin, but this, of course, on the scar, right? And you try to pull it out.
Okay. We were discussing the belly, like no tying.
Yes,
So she's asking, what about the traditional belly tying methods? I find those worse sometimes.
totally 100%.
Yeah, I would please see a physical therapist first before going for any of those. That's my opinion.
Exercise those muscles.
And to treat diastasis, we only need to
I,
zooming in movements. Shouldn't we exercise those muscles to help them go back to their place?
yeah, of course, we need to exercise those muscles, the core and the whole muscles. So not just the TA, the obliques, the rectus abdominis. We need to work with all muscles. This is usually how I work, my opinion. So we work the whole muscles. We target different core muscles, including pelvic floor, also diaphragm, right, rib cage. Everything is included on the area, and then different positions. We need to work on different positions to get different approaches, also with gravity, without, and then we need to lift weights also while we do this, right? Because we have a baby and we are lifting babies, right? So at the end, it's all a whole approach integral that I mean, there is no one exercise, two exercises that I can show today and then halas, you have it, you know?
Right.
So it's all about progression and to see how you are right now. Usually I do a video call with everyone, right? Like, hey, all right, show me your belly. Let me see how you do this. Where are you doming? Where not? So I check everything. How is it going? The function through some tests, and then I design the program. So unique, right? Personalized, customized program, exactly.
Yeah, that's amazing. Yep. And hijama. So hijama is wet cupping. When she means
Yeah,
it's
I
or do you mean wet cupping?
I mean not like the blood, right?
Yes, not the
Or
blood.
or yes, yeah, not the blood. It's okay.
Just the dry cups. Okay.
It's like crabs, exactly. It's dry cups, exactly. Dry cupping, it's fine. Yes, this is what I do every day at home.
Wow, you do it every day. Excellent. I should start as well then.
Yes, I will show you. Yes, I will prepare videos about it, but it's very busy
Put it on
times this
Physio
time,
Mama.
and
Yeah, do some videos and put them on
I
Physio.
know, I know, just the time,
Oh yeah, with two
it's
kids.
like I need more hours per day.
Can relate. Oh, I can so relate. I have so many mamas to get back to, and I'm like, I need a few more hours in my day. Alhamdulillah.
Exactly.
All right.
Breathing exercises since day one. You breathe in, when you breathe out, you go gentle, like going with the rib cage, opening a little bit the rib cage, inhaling deep breaths. When you do deep breaths, already you are moving the scar and you are moving a lot of things. So since the beginning, we should keep after
The gap you have after 3 C-sections, I would the same like Anna said, aim for 2 years ideally. Give your body time to recover. Okay, and the last question, I have 3 C-sections in 4 years and I'm 6 weeks postpartum. I've never checked for adhesions like this. Just used to do gentle movements on it, or is it too late to recover my scar?
go ahead and check the scar. All right. I'm coming to Kuwait in June, hopefully, also. I mean, I'm going to be there seeing patients also if it's necessary. So always like we need to check the scar and to see exactly, like if we have adhesions or not, or everything is fine. Maybe it's moving okay. Halas, it's fine. No problem. So everybody heals so different. I've seen like, right, 7 babies and then everything was fine after. And it's say, how? And one baby and everything it's, complicated. So
Subhanallah. Yeah, true.
everyone is different on that, right? So we are
Yes.
here to support. We are here to support, to guide, to educate, right? So that's our job at the end.
Yes. Okay. I think we are good with almost done with
Good.
everything here. So I just want to say a very, very, very thank you to Anna. I think so much pearls of wisdom. I will be uploading this video, inshallah, on YouTube so that more people can benefit. Please don't forget to follow her on all these both accounts. I'll share her link of her Instagram as well in the YouTube video and on the both groups. And please take care of yourself. Be kind to yourself. Everyone's recovery is different, like Anna said, and every mama is very special. Each one of you is going through a lot. Being a mother itself is a lot. Be kind, give yourself time. Every C-section mama, Anna and I, we hear you, we feel you, we've been there. Take care of yourself. You're no less of a mother. In fact, you need care even more so. So please, please, please just take care of yourself a lot, inshallah. And those of you that are listening in for the first time, my work is teaching online childbirth education classes. My next group in English is starting tomorrow. And then the next one won't be until after summer because then I'm traveling. So please, if you still haven't signed up, sign up now. I will cover all this. The pregnancy, nutrition, exercise, pain management, labor, doctor shopping, birthing positions, birth plan, all of that that you see on the screen, or you can find on my Instagram as well. I'll be with you throughout your journey, so please don't miss out on that. And I do have specialized workshops on all these topics as well that you can see on the screen on the left. And the next upcoming breastfeeding workshop is next week on Monday. That's the next event that's upcoming. So tomorrow the childbirth education classes start, and next week is the breastfeeding workshop. I hope to see you guys there. If anyone wants to register, please go ahead and do so. Just contact me, the admin of the groups that you are in, or just follow Hafsa KQ, and don't forget to follow Anna on these two accounts as well. So let's sign off. Thank you so much for your
Yes.
time, Anna. Really,
Thank you, Hafsa. Thank you very much for inviting me.
my pleasure. Jazakallah khair, ya'tik al-afiyah. Thank you, everyone that joined in. And we will see you at our next talk. I'm already thinking, I've got a few topics and things in mind. So we will definitely be coming up with more speakers and more exciting. I think I might have Lana with her birth story, her home birth story, which happened in Kuwait. I think she might be up next with me. And then I'm looking at mental health therapy as well. So lots of things to take care of. All right. Lovely messages. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.